Welcome back to the IBS Freedom Podcast, where we're going to tell you the truth and nothing but the truth. So buckle up, people.
Oh my
Amy,
gosh.
what are we telling them the truth about today?
We are going to be talking about conventional medicine.
Everybody's favorite.
I know. It's the devil, right?
Absolutely.
It's evil. Right. Yeah.
Well, and maybe that's a really good starting place to just rock and roll right out the gate here, is that kind of one of the premises of this episode is going to be that neither of us are strictly anti-conventional medicine. And this is coming from me, a chiropractor, and I will tell you, a lot of my colleagues in particular are very, very, very anti-conventional medicine. And,
Right.
you know, I could tell stories from chiropractic school and my interactions with chiropractors, but chiros are a weird bunch of folks, I will say. I love chiropractic, I love chiropractors, but I've met a lot of people who are extremely dogmatic in their anti-conventional medicine stance. I remember one time I went to a chiropractor myself, like as a patient, as an adult. And I remember I told you about it. I don't know if you remember this. This was like 3 years ago. But on his intake paperwork, he had something about like, do you take any prescription medicines? And there was a space for it. And then underneath that, there was like this little line about like, just so you know, like medicine, like prescriptions are terrible for you. And
Okay.
there was some, like, he added a line. It wasn't a question. It was a statement of like, I basically like, I'm going to judge the crap out of you if you take any conventional medicine or use conventional medicine whatsoever. And I remember being like, whoa, I hope that this guy's a really good adjuster and not like a crazy person. That's intense, but I'll find it later. But my point is, I think, unfortunately, you go hang out enough with chiropractors and naturopaths and herbalists and health coaches, and to a lesser extent, nutritionists and dietitians, and you get this really distinct tone of like, natural is always better. Conventional medicine is the devil. Wow, they suck at their job. I've been in seminars where a functional medicine person calls conventional medicine people clinical dinosaurs.
Okay.
Because it's this ego thing of like, we are really cutting edge in functional medicine and we know all the things that they don't know. And I can't believe they're not testing for leaky gut yet. I can't believe they're not testing for SIBO yet. How do they not know this? They are dinosaurs. And so it kind of dovetails into the Truth About Functional Medicine episode, really. But I'm going to start the episode saying I am very moderate in my stance. Maybe Amy wants to open up with her kind of initial thoughts before we get into the meat and potatoes of this episode.
Yeah. And I remember too being a patient, you know, on trying to deal with gut issues. And, you know, it was frustrating going to a conventional GI and them being like, we're going to figure it out. And then they're like, oh, it's just IBS. So it's not to say that conventional medicine has all the answers or is the best solution for every person. I think where we're coming from is a place like you were discussing where so many people aren't open at all to conventional interventions. And it could be doing a disservice to them because there is a time and a place for conventional interventions. And again, I think that some people, because they are so holistic or so kind of on the functional medicine side of things where they don't want to do any conventional interventions, because they're so far gone to that extreme, they're not open to things that might actually push the needle for them and could be a good tool in their toolbox. And so I think it's sort of this balancing act of like knowing conventional medicine has its limitations, which we can certainly talk about, but also knowing that there is some strengths to conventional medicine too. And knowing maybe when a conventional intervention makes sense and when it doesn't can be really huge in terms of getting better gut-wise.
I think that's the really big part of this episode, is knowing what to take and what to leave. Right. And like the thing that was popping into my head as you were speaking was the phrase throwing the baby out with the bathwater. And that's what I feel like a lot of people are doing. Again, especially chiropractors and naturopaths. It's like, oh, all of conventional medicine is equally horribly bad and evil, and we're never going to do any of these things. And I'm going to judge the crap out of you if you do use conventional medicine at all. And I do not agree with that at all. And I'll give a couple of examples from my life, and you probably have some too, but I had a pretty severe case of Lyme disease when I was 14 years old. And I'm sorry, I am not going to treat acute Lyme disease, which I acquired in Lyme, Connecticut, by the way, of all places. But I'm not going to treat acute Lyme disease with like lavender essential oil. Give me the antibiotics, let me nuke the thing and get through the infection, and I will deal with the consequences later. So but then on the flip side, again, using my own life as an example, looking back, I was the ear infection kid, and they gave me antibiotics like it was candy, one after the other. And they did surgeries that were most likely unnecessary. And like I went through a lot medically as a kid because conventional medicine is very like willy-nilly about antibiotics and about things like ear surgeries. So do I wish that my doctors or my parents knew like to maybe change my diet or reduce my sugar or reduce my dairy intake or take me to a chiropractor at a young age? Sure. But again, I'm not going to equate the abuse of antibiotics in my childhood to the use of antibiotics when I had an acute case of Lyme disease and I had Bell's palsy, for crying out loud.
Right.
Like two different things. One is a very appropriate use of antibiotics and one is not. So yeah, baby in the bathwater, people. There is good that you can take from conventional medicine if you are open-minded to it.
Yeah, for sure. I think too, like one thing I see a lot with my patients, and again, I think there's a lot of interventions you could try too. Like it's fine to maybe start with a functional or holistic approach, but then at some point it might make sense to go a conventional route. I think one example of this that comes up that has come up a few times are people that have like really chronic gastritis cases or like, again, even ulceration of their stomach. It's like, okay, if you're chronically having gastritis and you've tried all the like mucus supportive herbs, you've tried a bunch of stuff, like maybe it does make sense to do like a short stint on a PPI. Again, I think most people in the conventional space way overprescribe PPIs. Sometimes they misuse and abuse them. We've talked about this before, where like sometimes they're even using PPIs as a first line intervention for IBS, which makes no sense. So again, there's this push, I think, in the conventional sphere where they pop PPIs like candy, but there's also situations where I think it makes sense to potentially try a PPI for a period of time if you've had significant irritation or ulceration of your stomach, or maybe even like Barrett's esophagitis, or you have, again, like some more severe like upper GI issue that's not resolving from other things. Like take the PPI for a period of time and then just know that there's ways to get off of it. Well,
yeah, know that the goal is to get off eventually,
right.
But you know what? Honestly, I think that some of this is an exercise in self-compassion and compassion for other people, right? Like if you are suffering with, great example, with gastritis or an ulcer, you're going to make yourself suffer more, like more intensely and for a prolonged period of time because you're being stubborn and trying to resist the PPI. Like it actually might be the compassionate right thing to do for yourself to cut yourself some slack and allow yourself to go on the PPI while also doing the holistic, hippy dippy stuff and try to protect yourself and try to get off of it. But that's a really great example. And you know what else popped in my brain too, as we're talking about this, is it very much reminds me of nutrition in a way where a lot of people dogmatically say that processed food is bad, or sugar is bad, or seed oils are bad. And I don't think that any of those things are intrinsically true. Should those things make up the mainstay of your diet? No.
Right.
But are they intrinsically evil in any quantity? No. And like we have evidence to support that idea, by the way. So, 80, 90% of your diet should ideally be the foundation of whole, unprocessed or minimally processed food and like nutrient dense food. But you do have room in your diet for some bona fide junk. Like you could eat Doritos and live to tell the tale, and it's actually not going to increase your risk of disease or mortality in the long run if you keep it around that like 10% threshold. And similarly, I feel like if you want to do 90% of your medical and health stuff holistically and naturally, that's great, but leave that, 5, 10, maybe 20% zone to be open-minded to conventional interventions when they are appropriate and when you can use them as safely as possible.
Yeah, I think it's such a good point, because I think the functional side tends to scare the pants off people too at times of trialing anything conventional. I even think like the PPIs is a great example, because like you go to any functional website, they're like very anti-PPI. And again, I think in general, like we've said before, they're overused and abused. We've talked about that. But again, like they're not inherently bad, just like an antibiotic isn't inherently bad. It's just like they're overused and overprescribed, which isn't a good thing. But again, there's a time and a place to take an antibiotic. And I think this is a discussion I've had a lot with patients too, where they're like, I'm getting a surgery. I'm getting an oral surgery done, and I have to take an antibiotic. And it's like, yeah, it might make sense. Like, let's try to mitigate the negatives and just kind of roll with it. Or again, if they have like an outright infection that's not getting better, like strep or something. Strep's another one that I find like in some of the Crunchy Mom groups that I'm online, if Facebook wise, you can get some squirrely things that people are doing in the holistic.
Those groups are certifiably insane.
Yes. So, I think again, like there's a time and a place to be doing these things. Like you said, that on the nutrition side, none of those things are inherently bad. It's in the context of how you're using them. It's the same way with conventional medicine. If you're overusing conventional medicine and maybe even not looking at the functional side, that's not good either. Like looking at things potentially holistically might lead to better success, but having, like you said, an openness, like a 10% openness to pharmaceutical or conventional intervention makes a lot of sense.
Yeah. Yeah. And there's so many things we can unpack here, but I think you could think of it like a spectrum or a continuum, right? Like we have a lot of people, again, like chiropractors, for example, who oftentimes are very, very hardcore, way over to one side, no drugs, no surgery, never, ever, ever. I've never taken my kid to the doctor. I've never gone to the doctor. No, this is not a thing for us. And then we have like the conventional side, where oftentimes it is just drug surgery, and there's no attention paid to nutrition or lifestyle, or it's like maybe lip service at best. And neither of those two extremes are going to benefit the patient typically, or at least not all patients. I think that most people would be good in like the bulk of the bell curve, so to speak. You don't want to be on either end. You want to be somewhere in the middle where, again, like you have an openness to using a bit of both where it's appropriate and where it makes sense for you. But yeah, I mean, antibiotics, even honestly, mental health kind of stuff like antidepressants and anti-anxiety medications.
Yeah.
And again, I think that there's a lot of judginess in the functional space and on the internet health space. And I think that there's an air of like, oh my God, I cannot believe you would take an antidepressant. Oh my God, I can't believe you would take a benzo. Like, don't you know how bad those are? Or don't you know that they don't work? And like, I've read Kelly Brogan's book and I know all these things. And it's sad because I've seen people, most recently a patient, maybe 6 months ago, and there are people who would benefit from the wise use of these medications. in conjunction with everything else. I think the problem is if you have somebody with, say, depression or anxiety, and they just get given a pill and nothing else, like no talk therapy, no EMDR, no lifestyle changes, no support at home, no, nutritional intervention. If you only do the pill, that's where conventional medicine is going to fail you 9 times out of 10. But if you take the pill and it helps you, and then that gives you the bandwidth to do the other stuff and pay attention to your nutrition and your lifestyle and your movement and your whatever, then that pill can be a really great tool. And it's the exact same tool. It's just used in 2 different ways. You could use a hammer like a real hammer and like hit a nail, or you can try to use a hammer like a saw and you're going to fail miserably because that's not what that tool is meant to be used for.
Yeah, I think it's interesting. And I do agree. There's definitely a fairly harsh judgment on the psych medication for sure. I had a really interesting conversation with a lovely patient that I worked with. It's been a little while, but she listened to the OCD episode we had, and was basically saying like, oh yeah, OCD is definitely like a part of her equation. And she recently had she has a daughter who's like 15 who struggled horribly with OCD, like I think more traditional style OCD, so just like not wanting to be touched, like contamination fears, stuff like that. And this lady is a massage therapist, so again, like potentially like I would say more on the holistic healing type side of things. And but she was like, you know what? We decided to go with the medication. And she said she's never seen like a bigger shift in her daughter. And they'd tried, again, a bunch of other things. And again, it was just a good lesson too. Like, oh yeah, like, these medications have a time and a place. And this seems to be a really good fit for her daughter. And I know that she was doing like crunchy holistic things with her daughter beforehand, trying to kind of turn the needle. And I think, like you were saying, it can also be a bit of like a pyramid style approach. I know Jenna Overball, again, the OCD anxiety lady we had on episode, I think 105, she posted something and I forget what she was saying. It's some sort of model of care, which is basically like, you don't need to necessarily immediately jump into one-on-one therapy if you struggle with anxiety or OCD. There's kind of like, oh, you could do group work, you could go to support group, then you could do like group coaching, then you could do, again, like nutrition or lifestyle interventions. Like there's sort of a step ladder you could go through of like, ooh, what interventions work. And again, meds could be along that pyramid of eventually, oh, it makes sense to potentially try these meds. But yeah, I like the idea that you were describing too, where, some of these things could sort of band-aid things or help course correct things so that you can get back on track. Like again, for the gastritis situation, like if you're really having trouble with chronic gastritis, taking a PPI could just help kind of resolve that so you can move further downstream, kind of move to different issues. Again, psych meds could certainly help kind of manage the anxiety side of things or the depression side of things that might make it really hard to do lifestyle factors. Again, I would say too, I have had some people like pharmaceutical prokinetics. I don't think everybody needs pharmaceutical prokinetics, but I've had a lot of people, or a number of people, that have really felt like they benefited from pharmaceutical prokinetics, which again could be a good intervention. That's more on the pharmaceutical side. Go ahead.
Can I pause you for a second too? Yeah. Because you reminded me of another example where, again, like we're not telling everybody go take all the drugs, but we're also asking you to be open-minded potentially to some of this. But when you mentioned prescription prokinetics, yes, I've had some people like prescription prokinetics also. They usually come to me already on them, right? And then they can kind of like layer the herbal stuff on top of it later. But I remember I was working with this young man, and oh my God, it's going to stick in my brain forever. So we were going through kind of step by step, the normal way that I work with people. And we got to talking a lot about motility and vagal tone. And I gave him the lecture portion of FODMAP Freedom, and I had him going through that, like learning how to really tone your vagus nerve and how to really get motility going. And he got a little bit of help from, I think, Motility Activator, I want to say, but he was still working on some stuff. And I remember he came to an appointment and he was like, well, I asked my doctor if there's a drug that could stimulate the vagus nerve. And I was like, okay, like, I don't even think prokinetics do that technically. Like, you're getting into weird territory now.
Right.
And he Googled, or his doctor Googled, and he was like, yeah, so we're considering doing an acetylcholine esterase inhibitor. And like, do you think that that's good for me to take? And I'm just like, whoa, hold on. And meanwhile, though, we were still trying to focus on nutrition. So like, this guy was not eating enough calories, and he wasn't eating enough like fiber and protein. Like, his macros were all over the place. And if I remember correctly, like, he didn't really get out much, and he didn't have much of a social life. And I was really trying to nudge him to hang out with friends and like do more social things. And he did notice an improvement when he started doing that. But I had to talk to him. I think 2 appointments back to back, he brought this up, and I was like, bro, okay, hold on. Don't jump to a fancy schmancy medication, which probably is not going to be covered by insurance, by the way. And number 2, acetylcholinesterase inhibitors are not really used for this. I don't think it's going to stimulate the vagus nerve as much as you think it is. It's going to have like a downstream consequence at the synaptic cleft at the end of the vagus nerve. But that's different than like regulating the nucleus and the main part of the vagus nerve up in the brain stems. Like, I don't know if it's going to do what you think it's going to do anyway. But like, the medicine that you've chosen doesn't really match what you're trying to accomplish in the way that you think it will. And also, you're skipping a bunch of important shit, and you're just going for the drug. And that's it. You know that meme or the commercial that's like, that's not how this works. That's not how any of this works. I had those moments with him, and he's doing great now, but I had to really drill it in his head. Like, don't jump over the important stuff and just go for the shiny medicine. And so to be clear, I'm not telling people to do that. And I'm not embracing the willy-nilly use of medications. But again, it's different when you see somebody who would clearly benefit from, again, like a PPI or an antibiotic or an anti-anxiety medicine or an antidepressant or a prescription prokinetic, and they're refusing to take it because they have this dogmatic belief drilled in their head that conventional medicine is bad and prescriptions are all bad.
Yeah.
Right. So
I've seen a few clients be really weird about statins, even though they have like familial hypercholesterolemia, and it's like, it might make sense to like do a statin if your cholesterol's like through the roof. And
yeah, if it's like 300-400,
right,
and you know that this is a familial thing.
Right. I've seen a few patients like that, and they were like totally unalarmed, and I'm like, I might do something about that if it were me. But yeah, I think what you're describing a bit is that the functional medicine space, the holistic space, to me can get very judgy and like very like, this is the only right way to do something. And I feel like sometimes the conventional medicine is almost like not judgy enough, or like not assessing enough of what could be at play, where, okay, we're not looking at nutrition, we're not looking at lifestyle, we're not digging to the root at all. And that's where it gets problematic. I think, again, the functional side gets very like judgy, or this is the only way or the right way, or you have to have the right kind of holistic protocol. And so there's these two energies, whereas like the conventional energy feels like very flippant and again, maybe not well thought out for someone that's going in for IBS, where it's like, oh, you have IBS. You could do like an antispasmatic, or like maybe do Miralax if you're constipated. Like there's just not very many options, and it doesn't seem well thought out, or like do you get what I'm trying to say here?
Yeah, and I have something to add actually, and don't come at me in the comments, people. Don't.
Oh God, they're going to immediately come at you.
All right, so I'm just going to preface. I thought this of conventional medicine in recent years, and again, I'm not ragging on them intrinsically, but what I think might happen is, like, think about the path that people go on to become an MD or a DO or like a nurse practitioner or something, right? They have to go through 8 gajillion years of school and residency, and like they basically have to have perfect grades all through high school and college. Mm-hmm. And the most immaculate transcript and letters of recommendation. And then they have to interview well. And like, these are the most overachieving, nerdy people that get the opportunity to go to med school. And that's good. Like, I don't want some moron operating on my father-in-law when he has heart surgery, right? Like I want the smartest people to go to medical school, just to be clear. But we're selecting people who have learned how to perform really well in school. And a lot of times that involves a lot of rote memorization and just like drilling things into your head. And what I think happens, and again, like think of the amount of knowledge that like an MD has in their brain. They learned about every body part minus the teeth pretty much. But like they need to know like eyeball diseases, the most obscure eyeball diseases on planet Earth. They need to know like skin, surgery, like they have to know all these things. And so what I think happens is I think that the process leading up to and through medical school is so built on rote memorization and just cramming as much knowledge into your brain as humanly possible. I think that we're kind of breeding them to be memorization machines. And that's why we get this knee-jerk reflex where it's like, oh, hypothyroid, Synthroid, cholesterol, Lipitor. Yeah. And it's almost like you're just getting that out of the archive of your brain. And I think that this process of schooling drills all of the critical thinking skills out of the majority of conventional folk. Right. This is the part where I think people are going to get insulted. But I don't find that conventionally trained doctors in particular, less so with nurses, but conventionally trained doctors, I don't find to be exceptionally skilled at critical thinking typically. And that's why I think that that's one reason why. And also they just don't have the time in their schedule to like have a powwow with you and sit down for 30, 40 minutes and talk about nutrition and sleep and stress and all of the root causes. But I think it's like, they're not in a profession that embraces critical thinking, and they weren't really trained in their schooling to incorporate critical thinking into the way that they practice medicine. And also they just don't have the time. And so, you end up with this situation where it's like, okay, we need to name the disease and then give you a drug and then out the door. That's all I have the bandwidth for. And, it's like, it is what it is, but that's kind of the system that we have in place.
Well, and I think that's why it's conventional medicine is frustrating if you have like a more chronic condition, because I think a lot of times with chronic condition, like diet and lifestyle and digging a little bit deeper can most of the time reduce symptoms or correct the issue entirely, depending on what's going on. But I think again, when I almost kind of wish people could go to, again, someone that could really coach on nutrition and lifestyle and see what happens to a lot of their chronic conditions. And again, that's not to say that you would totally eliminate them, but, diet and lifestyle can certainly be huge for IBS. I think most of IBS is diet and lifestyle related. Now there could be other issues that still you might need to go conventionally and get some support IBS wise. So I'm not saying it never works out that way, but it can leave you feeling like, oh, that was a waste of waiting 4 months to see this GI specialist that just basically told me that I have IBS. and like, here's an antispasmodic and send you on your way. And it's like, well, that was kind of a waste. So again, I totally agree with you. There doesn't seem to be as much critical thinking or time to critically think and break down someone's case. Now I think, again, critical thinking oftentimes is lacking in the functional space too. Unfortunately, I think that when it comes to like patients that I see, a lot of times the people that have come a little bit more conventional without going super in the weeds functional are oftentimes easier to get back on track than people that are super in the weeds functional. And this isn't always the case, but I find that like functional medicine in a weird way can be more harmful in some of its messaging and, again, mainly dietary advice, like not giving proper dietary guidance and leading to like disordered eating type stuff can be so hard to dig out of compared to someone coming from the conventional space with IBS and being like, oh, I want something different. Now, that's not usually who comes to see us, but we sometimes get like the unicorn where they were diagnosed with SIBO at their conventional GI and they did rifaximin like 1 or 2 times and changed a little bit of their diet, but nothing crazy. And then you have, again, the other extreme where who has been to 10 different functional providers and are doing low FODMAP, low histamine combo,
AIP, low oxalate
for 10 years, and so it's like, whoa, that's just like a totally different dynamic than someone coming from the conventional space. So again, I think that a lot of times this idea that conventional is always can be really harmful, or like there could be some doing things that are unnecessary. Well, the functional side does things that are very harmful too, even though it's like potentially natural or nutrition and lifestyle advice. So it's something to keep in mind too.
Well, it's like on the one hand with conventional medicine, it's almost like, I don't want to use the word neglect, but does that make sense? Like they're not digging deep enough, and that's sort of the nature of the problem with them typically. And again, maybe not critically thinking through the case and thinking of root causes and thinking of other options other than drugs. So that's the nature of the problem on the one side. But like we said, on the flip side, the functional integrative naturopathic space tends to be extremely judgy, very like
fear-mongering.
Anxiety, like fear-mongering. And again, it's by design. I really think that a lot of providers are fear-mongering, at least partially intentionally, because they're trying to get you to get in the door. If they can scare the bejesus out of you, then they can convince you to spend $400 on their GI map or $300 a month on supplements or whatever. But like, it's kind of a hard sell to get people to spend multiple hundreds of dollars on supplements and do really hard diets. And so the way that functional medicine oftentimes motivates is with fear. And again, how much is intentional versus unintentional? I don't know, but I see it all the time with my world. But yeah, there's like judginess, fear-mongeriness, a lot of like OCD, anxiety kind of stuff. I'm pretty well convinced that the majority of functional medicine people have disordered eating themselves, and then they like them and their approach to nutrition and the food sensitivity tests and the diets that they prescribe induce disordered eating. So yeah, it's like you come out of the functional side. If you've been to 5 or 10 functional, naturopathic, integrative, whoever people, it's like you're almost guaranteed to come out with a lot of disordered eating, a lot of weird like judgments about food and health that you didn't know that you had, and a lot of like fear and anxiety and OCD-ish kind of stuff. And that's a really tangled mess to help somebody through versus, again, somebody who tried conventional medicine, they realized, hey, it's not enough and I want something different. I want to dig a little bit deeper. And then they come to us and then it's like, oh, wow, you're such a clean slate. This is refreshing.
Yeah, I think the way I think about it too is that functional medicine sort of like makes your whole life about solving this issue a lot of times, where it's like you're on this super crazy strict diet. You know, you're doing all these tests, spending all this money. You know, you're spending all this time planning all your meals. Like it makes your world smaller in a lot of ways. I feel like the conventional medicine world doesn't really affect that at all. Like it's not really changing the landscape of your life, which again, like could have downsides because like if
you're not changing your life,
right?
Therefore, the disease persists,
right? If you need to get a new job or you need to change your diet, like, and you're not doing it because you just got this pill from the doctor, again, that's not going to yield the results that you really want long term, typically. So yeah, I think that there's that going on, and it's so annoying because again, being us in the middle, I just feel like we're like a party of two, and more people are coming to the party, I think,
slowly.
But it's a wild world, like being sort of in the middle of these two extremes and kind of seeing taking the positives of one and kind of leaving the negatives, and then taking the positives of the other and leaving the negatives is so important when we're talking about like how to balance these two philosophies almost, and two ways of getting you better. I mean,
sorry, and to interrupt you totally, I want to take a little gratitude moment and say that I'm really freaking thankful for you and the fact that you said yes to this crazy podcast idea that I proposed, because I don't know about you, but for me, it was very lonely clinically for a while there, because I started really getting into SIBO and IBS, and I started looking at things critically and trying to figure out the low FODMAP diet and why it's recommended. And I started looking at the microbiome more critically, and I started having these different opinions than 90+% of the people around me. And so it was like, I practice by myself, and I'm a solo practitioner for one. So I was in my office alone all the time. Right. But also, it's not even like I could call a colleague and talk about what I was reading about or what I was figuring out with my patients, because nobody got it. So I'm just really glad that we found each other and we are pod people together, because I cannot imagine what my mental health would be like without you.
I wholeheartedly agree. I feel like, again, just having another person to be like, is this as wild as this sounds? Again, whether it's the functional or conventional side, like sometimes there's just really weird cases or circumstances that it's nice to share with someone, be like, am I like crazy for thinking this is as crazy as it is?
It makes me think about the thing that was going around a while back that's like, am I the drama?
Right. Exactly.
Like, is it me? Yeah,
I know.
We've had a lot of those moments together, but yeah, I'm very grateful for you. So let the record show. But I have one more thing I think I'd like to throw into this conventional medicine episode, if I may.
Yeah.
I think, again, we need to cut them a little bit of slack. You're still allowed to be frustrated with them and frustrated with your journey, but also think about what's realistic and maybe cut them a little bit of slack. Right. And I'm going to speak as somebody who lives in the United States. So I only know what the healthcare system is like here in the US. But like we all know, you try to book an appointment with a specialist and it takes months and months and months. If they're accepting new patients at all. A lot of doctors are not accepting new patients, period. So you finally find somebody and you get in with them. And again, like it's a quick appointment and a drug and then you're off on your way. But think about their day. Like have compassion for the other person. That doctor probably got to the clinic or the hospital or whatever at the ass crack of dawn. And they have probably been seeing 8 bajillion patients before and after you. They have to do chart notes. They have to do prescriptions. They have to answer portal messages or whatever bullshit they have to do in their day. Like they are probably exhausted before they even step in the door with you. And I do strongly believe that a lot of conventional people at least have a hunch that they are in a broken system. right? Like I want to give them the benefit of the doubt and say that most people get into medicine because they want to help people and they want to heal people. And I think that it's almost like a bait and switch. Like, I'm going to go to medicine so I can help people. And then they get into it and it's like too late to back out. And they're like, oh no, this is not what I thought it would be at all.
Yeah.
Darn it. And so it's like, I think that a lot of people in conventional medicine themselves have depression, anxiety, insomnia, or like mental health kind of issues because they're really, really severely burnt out. And keep in mind too, the vast majority of the people you have seen for your healthcare are not business owners. Like they probably work for a clinic or they work for a hospital, which means, very important with the SIBO world, that means that they actually don't have control over what tests they are allowed to order for you. So one of the biggest things I hear people bitch about is, I had to beg my doctor or I had to go to a different doctor because my stupid moron GI wouldn't even order me a SIBO test. And can you believe that? What a clinical dinosaur that person is. And it's like, they're not trying to be an asshole to you and they're not unaware of SIBO testing. They probably cannot order it because the hospital or the clinic that they work for doesn't even allow them to order that test. So even if that individual human being wanted to help you and agreed with your inquiry for a SIBO test, even if they agreed with you, they probably can't order it anyway. And that's just a really shitty place to be when you want to help somebody and the patient is either getting emotional or they're getting irate and yelling at you or getting crabby with you and your hands are tied and you can't even order it even if you wanted to. So
yeah,
that's one piece of it. And then I'll throw out one more while I'm rambling here is that a lot of conventional doctors don't order your test, the test that you ask for, because they know damn well that they suck. SIBO breath testing is a great example. A lot of GI doctors will not order a SIBO test in part because they know that they are inaccurate and borderline useless, and they're not going to waste your time and money ordering a test that's useless. But again, functional medicine, they'll dangle that carrot all day long and they'll bring you over to their side and say, ooh, you want a SIBO test? Let's run 5 of them. Let's do all the sugars. Ooh, this is great. Advanced stuff. I can't believe they didn't order this on you.
Yeah.
And they're not as savvy on the research oftentimes.
Yeah.
It's sad.
I agree. I think it's interesting. I want to shout out to my PCP, who has been fantastic. Just super compassionate. I think, again, it is okay to look for another doctor, too. Like, if you don't like your PCP or your primary care physician, maybe, again, you didn't jive with them personality-wise. I think it's totally fine to look for a doctor that you semi-connect with and that listens and is willing to collaborate with you. I think having that collaboration's important, but still knowing that conventional might be limited. Like, going into the appointment, you might not get 45 minutes like a functional provider would give you. You might get 15 if you're lucky, 20 if you're lucky, so but I do think, again, like my conventional PCP is great. He runs really thorough labs. He takes his time. He listens really intently. If I bring anything to him, I remember I brought him functional labs one time and he went through them. He didn't understand them, but he was like, he tried. He kind of understood some parts of it. I think it was a Genova stool test or something. So he kind of like knew some of the markers, but was like, I don't really know it, but like is willing to be like, oh, I want to understand what you're doing with the functional person. So again, like I think he's probably more unique, my current PCP. But even if you could just find someone that's like willing to listen to you, willing to maybe run some annual labs that might be a little bit more thorough. You can always order them on your own too if they won't order labs. But I think usually PCPs that I've worked with clients are usually open to running the labs I suggest.
As long as you're not picking something insanely exotic.
Right.
Like again, if you go to your PCP and and you ask for like a leaky gut test or or a GI map, they're going to look at you like you have 5 heads. But if you're asking for like iron, vitamin D, TSH, C-reactive protein, something like that, they're probably going to be able to order it for you.
Yeah. And I even think like sometimes too, like even, I've had some patients with EPI or like with some other conditions too, where it made sense to do more thorough like nutrient testing conventionally, and doctors have been open to that before. So yeah, and I think sometimes too, so all these lab like places that draw blood, they have coding. So like sometimes if the lab is working within the office, which is how my PCP works, they might just not know the code. So like sometimes you're asking them for a lab, they just like rarely ever, they don't run. And if you come with the actual code, sometimes they're a little bit more open to run whatever lab you're trying to run, which I think is helpful.
If you wanted, say like TSH, for example, you could do a Google search, TSH LabCorp, or TSH Quest Diagnostics, or Kaiser, whatever, system you're in. And it'll pop up with the listing, and you could print that off, and it'll have what's called a CPT code and the code specific to that lab. Right. But, you could do something like that. If you want to go one step above, I actually have another one. You could, if you have a diagnosed disease, or if you have a symptom that's like pretty well established, you could do a Google search, ICD-10 plus the name of that disease. And you're going to come up with a code, and basically like you need a diagnostic code, which is what an ICD-10 code is. You need a diagnosis that justifies that test in the eyes of the insurance company. So for example, if you wanted to test TSH and run it through your insurance, if you happen to have an existing diagnosis of hypothyroidism or Hashimoto's or fatigue or something like that, you could actually write those ICD-10 diagnoses down for your doctor too. And because sometimes that's the balk, is that they'll say, well, we're not going to order that because it probably won't be covered by insurance.
Right.
At which point you could say, oh, here are some of the diagnoses that I think I have. Right. And these would probably justify this test to the insurance. Like, could you run it with these codes? The other option too is you could tell the doctor, I don't care, I'll pay out of pocket for it. Can you please order it anyway? Right. That's another option. Or like you briefly mentioned, if you live in the United States and if you live in any state other than New York or Rhode Island, you can order labs through, I believe it's Quest. If you go to Direct Labs, I think it's directlab.com or directlabs.com, and you can order a whole bunch of different stuff, and it's run through Quest. So you pay for it online. It's not done through insurance. You pay for it online, you print off the requisition, and you just march your little fanny into Quest, and you can order just about anything your little heart desires as long as you're willing to pay cash for it. Right. So that is an option too. It's just they won't do it in New York or Rhode Island. Right. So, yeah. In which case you drive your ass to Pennsylvania and then you do it that way.
Yes. Yes. Yeah, I don't know if I have anything else major. The only thing that kind of comes to mind too, just because I'm preparing to deliver a baby, is it's funny. I feel like the first pregnancy, I was like kind of like not totally sold that I'd have like a natural birth, like again without any pain meds. But the natural birth space now is like huge on Insta, and again like. I don't think they're trying to be judgy, but they are in a lot of ways. They
absolutely are.
In a lot of ways. And again, like more power to you if you do a natural birth and that's what you wanted. Like that's amazing. So no judgment from me at all. That was kind of like my take was like, oh, it'd be like cool. I'll do some hypnobirthing. I'll see if that kind of makes sense for me to do. And luckily my hypnobirthing class, it was called Hypno Babies. They did cover epidurals, and they said, like, here are the times where it makes sense to do an epidural. And again, like, kind of stalled labor. They listed some different things to kind of get you in the headspace of, like, okay, I'll, consider that as an option in these situations. But basically with my last labor, I was standing for like 10 hours and was getting super tired and fatigued. Her heart rate was a little weird, so they were trying to kind of like expedite the delivery process. And eventually it was like, you know what? I'm going to get the epidural. I brought my birth plan. The actual doctors and nurses were super great because on my birth plan, it was like, don't ask me if I want an epidural. I will tell you if I want one. So they were kind of like playing it so like tight.
Coy.
Right. And I was like, I think I might. And they're like, are you sure? So it was like, again, it was very much like they're very respectful. I feel like my OBs have all been really great, which again, like the OBs kind of get a bad rap in the holistic space. But it's like, oh yeah, that epidural. I got that epidural. I ate some popsicles, pushed the baby out, and it was like a great experience. And again, like that doesn't necessarily mean an epidural is going to be a great experience for everyone at all. So I'm not saying that. But again, it was a good experience. I feel like, you know, if you just are looking at the holistic side, it's like you just hear all these like horror stories about, you know, different things with having an epidural. And it's just like, you know what, that worked for me. And I had a really pleasant, good birth and like bonded very well with the baby. And again, like it was like enjoyable from that point. You know what I mean?
I think it's like a risk assessment thing.
Yeah.
Right? Is that just because you hear a horror story or several horror stories, that doesn't mean it's going to be like that for you.
Right.
And again, it's like you kind of have to play a number game, right? The vast majority of people who take this drug are probably fine.
Right.
And a small percent, 1% get nasty side effects. Like that might be worth it versus you look at a different drug and the vast majority of people on that drug have bad consequences and like a small number of people get away with it. Okay. Like that you might want to hesitate a bit more.
Right.
And yeah, it's like, I know that there are absolutely people who have horror stories with all of the interventions we've talked about today, but there are also good experiences. And if I could piggyback off of your birth story, that was a really big lesson for me because I went into the birth of my daughter very like, I'm going to do this naturally, come hell or high water. I'm absolutely not having an epidural. No way in hell. Oh my God. And again, like this was when I was still a bit more in the functional medicine space. Like I don't even consider myself a functional medicine person anymore, honestly. Like I'm kind of in this weird island with just you. And we're like our own little ecosystem now. But this was when I was still pretty involved in functional medicine and like in that headspace. And again, I was in like the natural birth and parenting groups and I was like, all right, this is how it's going to be. Yeah. And that birth was absolute hell and long. It was so long. And I remember my one and only regret from the birth of my daughter is that I did not allow myself to have the epidural sooner. I made myself suffer for about at least 6 or 8 hours longer than I needed to. And I exhausted myself mentally and physically because I was being too stubborn and I did not allow myself to get the epidural. And when I finally got it, it was the greatest thing in the known universe. I finally got some relief from the hellish pain. I was able to take like a little teeny bit of a nap and I was able to get her out vaginally. But I joke, although I lost neurons that day. Like there are brain cells that I'm never getting back because the pain and the fear just fried some neuronal pathways and I'm never getting those back.
Right.
And like it would have been much more compassionate if I allowed myself to get the epidural sooner.
Right.
But I was being pigheaded and I was sucked into the dogma and I didn't even realize it. So, by all means, try to approach conventional medicine and its tools cautiously. I don't recommend doing conventional medicine and nothing else. Right. But if you're already doing the lifestyle and the nutrition and the holistic stuff and you need a little bit of help, we're not going to judge you for that.
Right. I agree. Good sum up.
Yeah. All right. Well, I don't think I have any better way to wrap this one up other than be compassionate to yourself and others, and you'll tone your vagus nerve in the process of doing so. And we will see you right back here for another episode of the IBS Freedom Podcast. Toodaloo.